I think that if there is one silver lining of the COVID pandemic was the collaboration from every physician all over the world. And, everyone came out with their own protocols. Everyone shared their experience. There were a lot of back and forth in social media, Facebook groups, people asking, hey, I saw this. Have you encountered this before? What do I do in this situation? And that was incredible and very, very helpful. A lot of mistakes, maybe perhaps due to unknown, that were done in other countries were omitted here because we had, the experience from Italy, we had the experience from China, from Spain, and we've learned a lot from other countries. One of our members of the International Relations Committee actually put together a survey for all of our members of the committee across the world. And it was very interesting to see how people shared and came up with different policies and different safety products, and it was very, very nice to have this collaboration, and it was a very helpful for everybody. The pandemic, unfortunately, the disease is still here, and so we know a lot more than we did before. And so I think that there are some challenges that we have seen in the past. Hopefully we'll be able to avoid them in the future. But patients are scared. And I think that's one of the main issues that we have still now today. Patients are scared coming to the hospital. We've seen at our center some more advanced disease because patients were not taking care right away of their cancer. And other disease that are not cancer related that are totally curable that have brought to long-term consequences to patients. So we really need to figure out a way to communicate with patients all the things that we have put in place in the hospitals to keep them safe, so that they can be taken care of their diseases and with a little bit less fear or stress about contracting the disease, the COVID infection. I think that this pandemic has really taught us a lot of lessons, and we will see consequences from it for a long, long time. First of all, it taught us that we weren't really prepared in general to face a new disease. We really didn't have the protected gears. We didn't have protocols. We didn't know how to best protect the physicians and the patients from this disease. So I think that fear and that unsettled feeling about what we experience will have long-term impact. And some of the things that we used to do, we'll never do it. I remember doing procedure without even putting a mask on, and if I do a bronchoscopy on somebody, I wouldn't even cover or protect myself, and that is not going to happen again probably in the future. So we all learn some lessons from this, and I think that we'll be more prepared hopefully in the future when this happen again. But we're not out of it either. After being in this issue for many months, I think gonna face some problems with emotional wellness and stress and the burnout. So those are all issues that we really have not addressed yet, but that we as physicians, but also patients, will have to face, moving forward, because there's a lot of fear around, going to the doctor or to the hospital these days. I think that the American College of Surgery has done a great job in communicating with the members nationally and internationally, and coming out with safety measures and protocols so that everybody could benefit from. And also from a anxiety and mental health wellness, there are a lot of resources that can be found online at the American College of Surgery website that can be really useful for now and in the future for physicians and also for patients to be shared with.